Good afternoon, Madam Chair and members. Christy Weiss on behalf of the Physician Association of California. We're really pleased to bring this bill forward. The Physician Association of California is focused on supporting small, independent physicians and has done a deep dive with the members of the association to really identify what are some of the barriers that physicians are facing in their day-to-day practices, and what are some of the challenges that are taking them away from the time that they need and want to spend on patient care. One of the number one issues that was raised are the challenges that physicians experience when they're going through the credentialing process with the health plans. There's a lot of red tape in this process, and in many cases a lot of duplicative processes that the physicians have to go through. So we've been working on this bill with Assemblymember Bennett and working with the opponents to come up with a solution that will work, that will streamline the credentialing process. With me today, we have one of our subject matter experts, Flo Di Benedetto, and I'd like to cede the rest of the time to her to share some more. Thank you.
Thank you, Christy. Good afternoon, ladies and gentlemen. My name is Flo Di Benedetto. I'm currently the CEO of a company called Di Benedetto Solutions. But I'm also a healthcare attorney, and I've been a healthcare attorney in California for over 40 years. I spent 28 years in private practice and most recently 15 years as the general counsel of Sutter Health. Credentialing happens to be one of my specialties, and I've represented physicians seeking to be credentialed, and I've also represented plans who are doing the credentialing for physicians. So I've been on both sides of this equation. As Christy alluded to, before a physician can treat a patient enrolled in a health plan or an insurance company, he or she has to be credentialed, which is a process designed to assess their qualifications. Do they have the qualifications, and are they safe to treat patients? Health plans and insurance companies have their own credentialing forms. There's no standard form that any of these payers are required to use. So over and over again, physicians are filling out different forms, but providing the exact same information to the plans and the insurance companies. And it's PAC's position and the author's position that and I agree, that having a standardized form required to be used by health plans and insurance companies would go a long way to reducing the burden on these physicians and many of the delays in the credentialing process. Larger medical groups have the resources to take on this kind of divergent and differentiating paperwork, either because they're large enough or many of them are affiliated with large health systems who do that work for them. Independent physicians don't have those resources. Putting timelines on health plans and insurance companies to expeditiously complete the credentialing process is also an imperative. These organizations can hold a physician's credentialing form for weeks or even months before it tells the physician that the form is, for one reason or another, incomplete and won't be processed. Health plans and insurance companies have the resources to devote and the staff to devote to processing these credentialing applications in a far more timely manner than they do today. In the system as it operates today, when physicians are delayed in credentialing, it's the patients who suffer because they can't access the physician for care. AB1041 will establish some long-needed transparency in the process and accountability in the process by standardizing the forms and creating a reasonable 90-day review period. The law will not reduce standards. It will reduce waste by streamlining the process, and I respectfully urge your aye vote to make credentialing more efficient to better serve our patients. Thank you.
Thank you so much. Me Too is in support of this bill.